to Ken Sharp, who is the Division Director of Acute Disease Prevention, Emergency Response, and Environmental Health at the Iowa Department of Public Health. And Ken actually has he has a presentation, but he also has an update to share regarding the power outage impact on vaccine distribution in our state. So Ken, welcome. Very glad to have you today.
Yeah, thanks, Tiffany. I appreciate it. As I look at that picture, that was somewhere around 30 or 40 pounds ago, pre-COVID. So the COVID impact has impacted a lot of us, I think, with lack of activity and doing too much work in the last year. So thanks for joining me, everyone. I appreciate the opportunity to talk to you today. I want to spend just a little bit of time, and I want to get you off to your respective breakout sessions. Just very quickly to the question regarding vaccine distribution and weather delays. We did experience some delays in receipt of vaccines. There was no loss of vaccine. So that started to impact us back on orders that we placed about 10 days ago to almost 2 weeks ago. So those vaccines are just starting to show up this week. So they're about a week behind in their delivery. But the ultimate impact is such that we're not going to see significant impacts in terms of timing. What has happened is we've heard several county health departments having to reschedule clinics to coincide with the arrival of the vaccine. So two things that I wanted to address today is first the vaccine allocation process and the planning that goes on across the state. And then the second thing I want to do is just provide some context for how we manage a limited supply of vaccine and who's eligible for that vaccine. So the first thing I want to just acknowledge is I think there's a perception oftentimes that the state of Iowa has this massive warehouse with stocks and stocks of vaccine supplies sitting somewhere, and that is not the case. That doesn't happen here in Iowa. We have 99 county health departments. Many of them are on the call today from the central Iowa area. And across the state, those county health departments for the last 2 decades have been asked to work on vaccine planning efforts for disaster response or pandemic response. And so each of those counties have their own plans, and they've been working with their local partners, whether it's their local hospitals, pharmacies, other healthcare providers, and others to look at how to reach these vaccinated populations once vaccine becomes available. So the decision making, in terms of how vaccine gets into arms is oftentimes handled most directly by that county health department in partnership with those local partners. In terms of the allocation process of how we get vaccine available out to the counties and to their partners, the CDC works with the manufacturers like Dr. Fraser was describing to identify the amount of production that's coming into the system each week. And then CDC and our federal partners look at largely a population-based allocation. The state of Iowa has about 1% of the nation's population. So each week we get about 1% of the vaccine doses that are available to states. And each week the Department of Public Health receives a notification from CDC to say, here's how many doses the state of Iowa is going to receive in the coming week. Where would you like those shipped to? And so when we receive that number, we then turn around and we also apply a county-based population allocation to county public health agencies. And we notify county public health agencies of how many doses they're going to receive. Each week in the state of Iowa, we're receiving through the state allocation process about 62,000 doses a week is all. And so when we take that and break that out across 99 counties, it's as little as some of our smallest counties receiving only 100 doses a week, and our larger counties receiving a few thousand doses a week. And so it's not making tremendous progress, as you might understand when you understand those numbers. So when we notify that county health department, we say, okay, where do you want these vaccines to go? The county health department then turns back to us and says, I want these vaccines to be shipped to these vaccine providers. Across the state, we have over 1,800 vaccine providers that are enrolled to provide the COVID-19 vaccine. About half of them are what we would call public providers, where the public can access vaccine. The others are oftentimes associated with employers, private healthcare facilities, or those types of things. And so once the county tells us that, we then place our order with CDC, and CDC and our federal partners direct ship to those vaccine providers, and we never touch the vaccine at the state health department. So it's a very smooth process, it's a very direct process, and it's a very timely process. When we place the order, those vaccines start arriving at those vaccine providers the very next day to maybe 3 days later. So it's very quick. So that's how the vaccine gets into the state. There isn't a central warehouse, and it really is a partnership. In addition to the state allocation process, we are also seeing a couple of other programs stand up at the federal level. One is the retail pharmacy program, where we currently have Hy-Vee and then the network of pharmacies through CPESN. There are about 65 or 70 pharmacies that are currently engaged in those two pharmacy chains. And those two pharmacy chains have a total of about 240 pharmacies. And we have a lot of other pharmacies kind of in the waiting. As vaccine supplies increase, they will be added to that retail pharmacy program. That brings in about another 10 to 20,000 doses each week into the state through those pharmacy networks. And then in addition to that, there are some other federal programs direct to federal agencies that are in the state, or the federally qualified health centers. We will have one federally qualified health center in the eastern part of the state, likely activated in the next couple of weeks. So there's the good news is each week, each month, we are seeing more and more vaccine coming into the state, but it is still limited. And that's kind of the transition to the next point that I want to make. And if I can, Tiffany, I think I can share. Oh, am I able to share my screen, Tiffany, if I pop up a website?
You bet. Leah will give you sharing capabilities here momentarily.
Okay. So I want to talk through the next thing. Yeah, here we go. I'm just going to pop up our website and just navigate folks to the website. Tiffany, can you just give me a thumbs up that that came up okay? All right, thank you. So when you first log on to the Department of Public Health website, there's a banner across the top that has our COVID-19 information. This page here will navigate you to a variety of resources that we have. I do want to just talk through how, in the time of a pandemic, how public health manages getting the vaccine to those populations that are most at risk. And you heard Dr. Fraser talk earlier about the populations that had the most severe health outcomes. The older you are, the more likely you have a severe risk of consequence or even death. And so in public health, when we're in a pandemic, when we deal with shortages of supplies like vaccine, there are some tools that we have that will help limit and restrict the use of vaccines to certain populations. And so there is something called a vaccine shortage order. And I want to just draw this to businesses' attention, because this will be important for you to understand when you may actually be available for vaccine. And so this shortage order is a legal document. It's a boring read, but it does reveal some pretty important information. Particularly in this section here is where we start to talk about the eligible populations. So we've already went through phase 1A, which was our healthcare personnel and residents of long-term care facilities and the staff there. We are currently in phase 1B. So phase 1B has a two-pronged approach. So we're currently vaccinating anyone 65 and over. And then we're also beginning to work through tiers. And there's a 5-tier system that is in phase B that gets to other special populations. The Advisory Committee on Immunization Practices, ACIP, is a federal agency or federal organization that made recommendations for a variety of essential workforce. In addition to that, then Iowa took a look at this, the ACIP recommendations through an organization that we call IDAC. It's the Infectious Disease Advisory Council. That council took a look at the ACIP recommendations and also took a look at data like what Dr. Fraser was recommending. And Iowa took a bit of a different approach than ACIP did. And bottom line, IDAC felt it was important to focus vaccine to access and provide protection to those populations in Iowa that are the highest risk of exposure and the highest risk of consequences. And so when we look at this, there are a lot of essential workforce that are identified in the ACIP model that are not in Iowa's phase 1B, nor in phase 1C. And so as we work through where we currently have most counties working is in this population. So it's the 65 and older plus first responders, and then pre-K through 12 school staff and early child education and child workers. Where many of the where many of the workers or employers are interested is in this section here. And I want to make sure that folks kind of understand this is not all business, and this is not even all agricultural, food distribution, and manufacturing sectors, but really it's a two-part eligibility requirement. And again, what we wanted to focus in is on the highest risk and highest risk of consequences. So when we look at businesses, we're looking at these sectors: food, ag, distribution, and manufacturing, who work in, and this is the second component to this, who work in or live in congregate settings that do not allow for social distancing. So we have a lot of manufacturing, a lot of industry in these sectors that have plenty of opportunity to social distance in the workplace. And we're asking them to continue to use their good mitigation measures that they've been very successful with over the last year, and wait a little bit longer until vaccine supplies become more available so that we can get to the highest risk populations. And so that is oftentimes, I think, frustrating for folks to understand and see, but we wanted to make sure that folks understand that there is a very intentional focus on those that have the highest risk of exposure and highest risk of consequence. And if you're not in that group, then what we ask is continue to use your good mitigation practices and wait a little bit longer. And we're being told that perhaps as early as April or May, we'll see vaccine numbers increase well enough. And so, Tiffany, I think with that, I'm going to stop to respect the time of everybody's involvement with the counties, and I'll open for any question or a question if you want.
Thanks, Ken. Thanks for this. And we can drop the link to this website in the chat just to make sure everybody has it at their fingertips. Ken, I did receive one private direct message here with a question that I'll throw out to you, hoping you can shed a little bit of light on this. The state website shows 442,000 vaccinations that were given between the first and second dose, but shows 589,000 total doses that have been administered. So just wondering if you can help us understand that sort of difference between those two numbers that are currently being reported.
Yeah, so that's a math problem. So if you look at the individuals with the first dose, that counts as one dose for each individual. For the people that have completed the series, all of those right now have had 2 doses. So that number that have completed 2 doses, you've got to take that times 2 and then add the individuals that have had 1 dose, and that'll equal your total number of doses administered to date.
Thank you so much. Really, really appreciate that. And appreciate your time and all you and the Iowa Department of Public Health are doing